So, hello everyone. This is Srirekha. Welcome back to Zesty Nimbu. Today, I'm along with my brother, Dr. Pavan Panchavati, and we are going to talk about the coronavirus. And he is here live so that he can answer all your questions. If you have any question, keep putting that on the comment section. So, for today's agenda, so as I've just mentioned, it is a live question and answer with Dr. Pavan Panchavati. So the agenda for the day is, first of all, we'll have a small presentation by Dr. Pavan. He'll be going through the slides that he has prepared. And then later on, we'll ask the questions, frequently asked questions. And then finally, we'll open the floor where the audience or you, whoever is watching, will be able to ask your questions. So keep putting your questions in the comment section, and do share this live stream with everyone of your friends and family, because this is very important. And in these times, coronavirus is a great pandemic, and we want all the information that we can have. And who better to answer than Dr. Pavan, who's actually working as a lead hospitalist and who is working with the corona patients day in and day out. So he'll be in a position to answer all your questions. So I just wanted to ask everybody whether we are visible, audible, and is there any issues? Do let us know. Once we get a go ahead from your end that everything is fine, we'll be starting with the presentation. So please let me know. So yeah, we are getting questions already. So do let me know if you guys are able to see us. Just waiting for a confirmation from your end. Is everybody able to see? Super. So we have received confirmation from few of our friends here. So they've mentioned that we are visible and audible. So that's super. So as I mentioned, the agenda of the day is basically for this. Anna is going to introduce, about coronavirus. Basically, give a presentation on that, and then we'll be taking questions from the audience. We'll be opening the floor, and we'll be taking all the questions that you guys have. All right. So let's start with the presentation, Anna. So if you can just introduce yourself and let's start with the presentation.
Hi, everyone. Good morning. Thank you for having me here. So Rekha was wanting me to talk about this for a long time. We did this some time back, which was totally about, what was new in treatment. At that point, we didn't know what was going on, so we have a lot of information. We have a lot of positive news. The whole point of this presentation is to, tell you what's going on with respect to treatment. There's a lot of positive news. And I want to emphasize, and hopefully by the end of this presentation, we're going to take some fear off of the coronavirus for you guys. So let's begin. I made some slides which Rekha can share with you for reference. So to begin with, I'm Dr. Panchavati. I have a lot of degrees. And I teach at UAB. I'm a clinical associate professor teaching the postgraduate residents and junior doctors. And I'm also the lead hospitalist working at Huntsville Hospital and Madison Hospitals, taking care of coronavirus patients day in and day out. As Rekha said, we learned a lot going into this. So let's go to the next slide. I wanted to tell you what's going on latest with respect to treatment protocols. Before that, you guys, my audio is okay. I just wanted to make sure the audio is okay. Can you hear me okay? If you can just tell me, then we'll proceed.
I think you're audible, Anna. So you
Okay.
can just go ahead with the presentation.
Good. So let's go with the latest in treatment protocols. There's some groundbreaking research that's going on. So, there was a recent article at BBC News which said that yes, steroids are helping. But there's two parts to it. So the study, they said that, the steroids are helping, and yes, it's working. We've time tested it here. It's working. So two things to it. So it's the study said that steroids are beneficial. Okay, the dexamethasone or the decathlon, what we are using, is beneficial for people who require oxygen. Okay, it helps their recovery. But we're going a step ahead now, and we're trying to test people who have been tested positive with mild symptoms. We can give this dexamethasone by mouth. Okay, it's tablets you can take, and those things help you. We have seen success. So hopefully we'll do a study soon, pretty soon, and get recommendations. So uh, it is helping, and people who are in the mild cases are not becoming severe, who are in the severe stage are not becoming way too sick. And even if people are very sick, we have medications. People who are on the ventilators, we have medications now which kind of mitigates the disease. So that's steroids. It's a very exciting time, and I think we'll have a definitive breakthrough with the steroids so far. So the next thing is hydroxychloroquine. Again, big controversy, big studies which were proved to be flawed, saying that hydroxychloroquine is not working. But again, I've read the Indian Council of Medical Research. They're using it for prophylaxis and treatment. But we will leave the controversy, and we'll say that if somebody is using it and it's working for them, let them use it. Okay, so the hydroxychloroquine and the azithromycin, what we call as a Z-Pack in India, um, which we use for sore throats and bronchitis, that's the combination should be only used in clinical trials or in the hospital, not somebody prescribing it to a patient. So we'll just leave it to the trials at this point. So the next medication I'm going to talk about is remdesivir. So this got a lot of publicity. In my earlier podcast with Rekha, we were saying that this is working with the Gilead Sciences. So there's a lot of shortage here. So, and this is proven to be beneficial in the early course of coronavirus. Okay. So, but the good news for people back home in India is, I think some local companies manufacturing remdesivir, and we should be having them in India pretty soon, actually within days. Uh, so the next medication, what I'm going to tell you, is a life changer, the tocilizumab. This is kind of like a super potent steroid of that class. It suppresses your immunity a lot. It's not steroid, but it's kind of like a big brother to the steroids. So this we have used successfully in people who were on ventilator and there was no hope. The tocilizumab works absolutely, and we got people out of ventilators and they've gone home. So the biggest breakthrough we were talking about the last podcast was the convalescent plasma.
Right.
So yeah, so basically plasma, I would define it as, you take blood and you take red blood cells out of it. That's plasma. So if somebody got sick and they recovered from COVID, their body produces antibodies to this virus. So these are the people we collect blood and get this plasma ready. I think it's easily done, and we should be able to do it back home in India. We should be having blood banks that should be taking care of this. Okay,
So, Anna,
so
these are all the treatment techniques which are being worked on right now, right? These are all the treatment techniques that the doctors across the world are using at
yes,
present. For
and this is successfully used. This is not something we are using the tocilizumab, the convalescent plasma, the remdesivir, the steroids. These are successfully used. This is not like we are doing an experimental study. These are people whom we started them in the hospital when they came in at different stages of the illness, and they recovered pretty good. Okay, so we're going to talk about more treatment options, just as we go down the slides. But the other thing I wanted to talk to you is, antibody testing. So, the testing for the COVID, a lot of people are becoming positive without symptoms. Is it a true? And then they say that he got the infection again. That's a second wave of infection. So if a person A was tested positive for coronavirus, and then he recovered, with minimum symptoms or no symptoms, and then he goes out, and then he gets the disease again. They say that, oh, there's a different strain. But you have to always realize that the testing has a false positive value, meaning that the test may be showing that you are falsely positive even though you're not positive, and then that guy goes out and he gets the infection, which is true now.
We
So
actually
for
seen a lot of such cases. People are
yeah,
going falsely positive, and then you know, then suffering, and then again when they're going out, they're getting the COVID. So yeah, so that's a very live case at this point in time. Yes.
So the breakthrough we're giving is we're testing the antibodies, meaning that if somebody got it and they don't know, they didn't get tested, they said, hey, I had symptoms of this, can I get tested? So we're testing this antibody, which is not widely used now, but if we get a definitive answer is, if you have an antibody, yes, you've been infected. And the rate of reinfection in them, we have not seen anybody getting it. So that's something which we have to consider back home in India, the antibody testing, which may tell you whether you had the infection for sure or not. Um, right. So the big talk about everybody is the vaccines. Hey, when am I going to get the vaccine? Okay. So the
Right.
vaccine, there's a lot of news channels. People are sharing that, oh, there's a breakthrough. It killed the cells in the rats. It was tested. It was manufactured in the rat cells. It killed the human cells, with COVID virus. So that's how vaccines are made. So, there's a big process for the vaccine to be made and to be tested successfully. So more than the news channels, the good news is we're already into human trials in a lot of places, and realistically it will be next year. So don't expect that once you have a human trials it comes out. It will come out in phases. They're going to see how it's going to work, and it's going to be given from the healthcare professionals all the way to the high susceptible people, and then till everybody gets it, realistically 18 months more. So
18
uh,
months.
yeah, 12 to 18 months, 1 year, absolutely, to for everybody to get it. Okay. um, right. So uh, the wax, so the blood thinner. So this is one more thing where there's a video circulating. I'm sorry, I'm
Uh,
taking a little bit more time, Rekha, because I wanted to
Somebody just mentioned this.
Mhm.
Just now, listen, Glenmark has launched antiviral drug favipiravir. So, do you
so
have any about this?
yeah, that's a good question. See, the favipiravir is working. So it was in Japan. That's the only thing they said. They did a lot of trials. Okay. So the favipiravir is working. So if it's done in Glenmark's doing it in India, that's shown to reduce the viral load. It's helping. So yes, I think that's a good question. Because it was not manufactured on in a large scale, it was only limited to Japan. I didn't mention it to it, but if Glenmark's doing it, launching worldwide, that's good for us. Okay, so that's
Super.
working. That's an antiviral. That's working. That's an oral medication, by the way. So it should be good if it comes out in the market. And I've read about the studies. They're very very positive about the
Yes.
outcomes with this. So and blood thinner. So here's the thing. So there's a video sometime back. Everybody asked me saying that, hey, the coronavirus is actually a bacteria, which is not true. There was some truth about the fact that you having the body is forming clots and people are dying of blood clots. There is some clots. So the viral infection is triggering the clotting pathway in our body. So they become, some people who are prone, not everybody gets this, some people who are prone are forming blood clots. So you know um, we have put people on blood thinners. Initially, we were giving a lot of blood thinners. There's a treatment dose, there's a preventive dose. So we are doing somewhere in between the treatment dose and preventive dose. So it's helping a lot. And now what we're proposing to people who are on an outpatient basis, meaning that who are not admitted, We are doing trials with a full dose aspirin, that is 325 milligrams of aspirin, along with steroids, the dexamethasone. That will be, I think, going forward, that will be what everybody will be tried on to prevent them from becoming bad or getting admitted to the hospital. So uh, that's about blood thinners. And then, grandmother's recipe always works. Okay, so you're at home, you have a cold. It's a glorified cold, to be honest. Coronavirus, it's a glorified cold. So, your grandma gives you tea, gives you lemon, honey, whatever, just take it, and it works really well. There's a lot
Right.
of love attached to it, more than the actual science. So I would take it any day.
Right.
Uh, so the only thing is, the social isolation is the only treatment I can say that that's going to effectively work. Okay, so let's go see why we want the social isolation. Let's go to the next slide. Rebecca. So the benefits of social isolation. See, if I get a disease, if a young person gets a disease, right, he will not have any symptoms. So he goes home, and even though he has mild symptoms, he just goes around, and he can spread it to his family, friends, and there are people who are susceptible. Susceptible people are the people who have comorbidities, meaning that if somebody has heart problems, somebody has lung problems, diabetes, any vascular or vascular problems, these are the people who are being affected most by this. Not everybody gets affected. These are the people who are likely to go into the hospital. Okay, so again, social isolation, if a lot of people are getting it now when the economy is opened up, so there's a huge surge of cases. So, if there is a decreased hospital burden, case burden, if somebody comes, I can treat 5 to 10 people in a day easily than treating 100 people, because I don't know what I'm doing if I get 100 people, and I don't know how I cannot put everybody on ventilators and with limited resources. So I would take 5 to 10 every day and treat them, and will get them out of the hospital. So again, we talked about a third of cases are asymptomatic, meaning that they don't have any symptoms. Okay, next
Right.
slide. So again, prevention, you want to do masks. There are a lot of masks. The medical professionals have the N95 mask. I'm going to show you N100 mask, which is very rare to get, but I have got one, so I'll share it with you.
This
So
is N95.
yeah, these are the N95 masks. You can see I have them. I shared a picture with Rekha. So the N95 mask is 95% filtration rate. If you get it, that's good, but you shouldn't panic. The other ones on the plastic on the side are the 3D printed mask. So the N100 is the one I wanted to show. This looks like a mask from Star Wars. Can you see it, Rekha? Yeah. So it has a filter. So this is like you can attach it and detach these filters. So this is very rare to get, and somebody gave it to me when I treated him, because he was working for the government.
Can
So
you show it again?
yeah. So there you go. So this has a filter. Where is it? Okay, this has a filter. You see that? And that's the filter which you fit it. Okay. And then that's like a cartridge. So got back. So this is like a cartridge. You fix it, and you take it out. You have replacement cartridges. This is very comfortable. Looks a bit tedious than the other masks, but this is more comfortable than any of the other masks I've wore, including the face mask. I mean, the regular cloth masks. So, okay, let's go to the next slide. So again, you have to mask yourself, and when you are at home, you want to stock the basic medications. In India, especially the ORS powders, you don't want to get dehydrated. Paracetamol for fever. We're still not using ibuprofen at this point, but get your necessary groceries at home, and prepare your home. You cannot escape this. Okay, this is like a glorified cold, and people will get it. So we're going to talk about stigma later on, but you cannot escape these things. So I would stay at home and get all these things. Assume and prepare the home that if somebody gets sick, I'm going to take care of them. Okay, and the 6 feet distance helps all the time. So one more fun fact about the mask is, they did a big studies about people who have coronavirus wearing the mask, and two people wearing the masks. Okay, person A has coronavirus, person B does not have coronavirus. Three case scenarios, both of them not wearing masks, the chance of spread is 100%. Okay, so the person not having coronavirus wearing a mask, the chance of spreading is 50%. Both wearing masks, it's less than 1%. So
Oh,
the important of masks is you should, two people wearing, especially the person with coronavirus, if he wears mask, we're good. Okay, I think we're taking too long. Let's go fast. I want to emphasize on some things, but I want to get the fear
yeah.
out of people. That's my whole goal here. Okay, let's go. Let's go to the next slides. Right. So, this is what I want to tell. A lot of people are being quarantined at quarantine centers. That's good that they're getting it done. But, when you are at some place where the quarantine is not an option, that's beneficial of home quarantining versus quarantining at other place. But if somebody is sick at your home, you don't panic. Don't run away from the home. Okay. It's your family. So we're going to take care of them. Okay. So this is how, I put these details. Basically, let's keep them at a separate space. And if there is not much space, because it's a problem with a lot of people in India, is we don't have much space, shared space. So make sure, if you don't have space, we're going to wear masks. We're going to make sure that the windows are opened and there's a good airflow. Okay, always clean your hands with soap and water for 20 seconds. That's the best thing. Okay, and now somehow the sanitizers have become so fancy that we're using it everywhere. It's the ease of use is good. You don't need water for that. So the fun fact about sanitizer is, if you put a sanitizer and you don't let it dry, it's not effective. So for a sanitizer to be effective, you guys have to rub it and wait for it to dry. Then only you think that okay, I've sanitized my hand. Okay,
Oh,
so you
okay.
can't put it in the hand and go out do something. You're gonna get it for sure. So, but time tested again for any virus, soap and water, best, cheap, and best use. Okay. So the three case scenarios here, I think, Rekha, can you share this with all the folks when we are done? You can put it in your website or wherever you want to. So three case scenarios is, if a person is diagnosed with coronavirus, when can I go out? Okay. So the magic answer is, if you are tested, so you got some symptoms, you got and tested, so you want to quarantine yourself at home, and then in a different room if possible. And you should not come out, you should not come out for 10 days, to be honest. The whole thing takes 10 days, but you are considered transmission free, meaning that you're not going to be transmitting the disease to others in three case scenarios, where for 3 days you're not having any fever, no cold, cough, or any dry cough or any body aches. If you don't have those things for 3 days, and then the other symptoms have resolved, and then at least 7 days have passed, let's do 10 days. The new guidelines recommends about 10 days. So from the onset and no symptoms for 3 days, it should be about 10 days. So people are doing it for 14 days, which is reasonable. But again, 10 days is what it is recommended. Okay. So this is for people who got tested and they're not going to get tested again. So go to the next slide. So people who are tested now, so people who have access to the facility where this is being tested, so you get these things tested, right? So you get you test it, it's positive, and then you're gonna go home, and then you're gonna take care of yourself or quarantine centers, and then you are symptom free for 70 days. See, the thing is, why I'm saying that you're gonna be okay, because 80% of the people who have this coronavirus don't have severe symptoms. So that's why I don't want you guys to feel bad if somebody gets it. I heard that the neighbors are vacating the homes. That shouldn't happen. I mean, if you had a cold 6-7 months back, will you vacate your home? No. So I want you to be realize that this is in 80% of the cases, we don't have much symptoms, and people are recovering very well at their home environment. Okay, so if you have a test, then what you do is your symptoms are done, then go back to your doctor and they test you, it's negative, go back the next day, you test negative. So the last point here is they receive 2 negative tests in a row, 24 hours apart, they're free. Okay, they've recovered and they can go out. Okay, so
Okay.
next slide. So people who did not have symptoms and who tested positive, okay, again, the same symptoms happen. You don't know whether this is a false positive or true positive. Either way, if it were somebody I know, I would say that, hey, please go home, stay at home, drink all that grandmother's recipes or mom recipes, eat fruit, do yoga, listen to music, have fun for 7 days. And, and then just avoid going to your friends or group for the next 3 more days. So, I got a question. Okay, so okay, go ahead. Go ahead. So there's a lot of questions. Somebody asked me if we can wear a mask
We'll
when
take
you're
the
going.
questions at
Yeah,
the end. Just finish off with your
sure, sure,
presentation,
sure,
and
sure. Give me. Yeah, we're almost done. Okay, go
yeah,
ahead.
we'll just
Next.
finish off with the presentation, and then we'll go ahead with all the questions.
Sure, sure. Next slide. So here's the thing. So when somebody is at home, they have coronavirus, and you're taking care of them, or your neighbor, you're going to drop off food. No, nothing wrong to go to their home if they are alone by themselves and dropping them some food in front of their house. Absolutely, that's what we grew up doing in India. That's what we should do. I strongly believe in it. So if they have, the warning symptoms is if they're having severe shortness of breath, okay, they can't breathe, they're having a lot of chest pressure, they're confused, and they have bluish lips or face, this is the indication for them to call the emergency and go to the hospital. Okay, not everybody who tests positive should go and sit in the hospital and burden the health system. This is like the specific things we want to make sure we do before we go to the hospital. Okay, and if you see anybody with this, call the emergency for them, please. Do some favor to your neighbor and fellow human being. Let's go. Next slide. So that's me. Actually, we were testing a lot of equipments, and we are being tested and make sure that nothing leaks out of our N95 and 100 masks. It's tested. So this, I want to take a minute here. So Rekha asked me a question that why are medical personnel getting this, right, Rekha? We can
Yeah.
answer it later, or you want me to answer it here? So either way is okay.
We can answer with this particular slide.
Sure,
Most of
sure.
the, I
So,
mean, many doctors are also getting, corona positive, right? So,
yeah.
what is the fault? I mean, that has
So,
happened.
there's nothing fault. I mean, I'm not here to pick up faults of everybody, but here's the thing. So you have an N95 mask, you should know how to wear it, and everybody has to be tested for that. So there's a mechanism by which how you test whether the N95 is fitting you properly or not. So the N100s or whatever the cloth mask, it should not fog your eyeglasses when you're wearing it. That's a simple test to do it. We've been tested with perfumes and all that stuff with the face shields. But again, end to end, morning to evening, you have to be covered. When there's a specific way you remove the masks, from the side, you cannot touch it in the front. So this it has to be tested. So it can be an institutional level error, it can be an individual error. Okay, but these are all N95 is 95% particulate, so there's a slight chance that you can get it. But again, it's for only people who are susceptible. So there's a lot of isolation procedures we need to follow. Despite doing the best, people can get it. So it's unfortunate that doctors are getting it, but
Yeah, yeah.
if we can fix something, it would be good. Okay, let's
Okay.
go to the next slide. Okay, so when the economy is opening up, everybody is like, "What should I do? What should I do?" So here's the thing, take these precautions. I'm not gonna go into it because we have a lot of questions on this. Keep wearing masks, keep 6 feet distance, avoid non-essential air travel. Any functions, marriages, restaurants. Just avoid it. Till we get the vaccine. But it's not a strict saying that you have to sit at home, but again, be mindful. The enemy is powerful at this point, so you just don't want to go and attack it, or it's like I know we all relate to cricket, right? So the first few overs, if the bowler is steaming into you, you want to make sure that you leave the ball, play defense, and then you can hit them. So we're at the stage where yeah,
T20 or
yeah,
international. Yeah.
yeah. So again, so health again is physical, mental, social, spiritual well-being. So if you're at home, you do all the things you're doing. If you're spiritual, go do some meditation, and eat healthy, sleep good, and be happy. I think we have to be resilient. That's what we're going to come up next slide, I think. So right, so everybody is like fearful that this is going to get me, and it's unfortunate that I've heard stories that people who heard that they had coronavirus died of heart attack. So the thing is, the virus itself will not kill you, okay? The fear of it will kill you. So if you have it, don't worry, and don't be avoiding people, or being stigmatize other people who have it. It's unfortunate that they got it. We may be in the same situation down the lane, we don't know. So when you have the disease, you be positive and be resilient. So this is the resilient is a term which I heard a lot of psychiatrists talk, and we have it. Indians are very resilient. So all we need to do is, I can beat this any day. So that's the feeling we have to have. If you have that feeling, we're gonna beat it any day. Okay. So quarantining at an unknown locations can cause anxiety, panic, and depression. I've heard that people are being whisked away from their homes, put it in a different quarantine. It's all in a good cause and faith that these are being done. But again, it has to be on an individual basis, that if they have space at their own home, they should be given an opportunity to quarantine themselves at home. I personally feel, seeing a lot of people and working in a lot of places, medical places, that the best place to get help and get healed is at home. So always support your family, support your friends, don't stigmatize them. Go ahead to the next slide. Right. So this is one thing I want to talk to folks back home. COVID is not a death sentence. Okay. I mean, I have had people on ventilator for weeks. We got them out. They walked out of the hospital. These are extreme cases. In a day, we have about 400 to 500 cases who are being positive. We send them home. Only 10 or 20 people get admitted. After 20 people, only 5 people are sick, and we got them out of ventilators. Initially, when I did this podcast, we were having people die at an alarming rate because we didn't know about this disease. Now we know that this is not something which is like an Ebola, like you have death sentence. Ebola even has a vaccine now, so they're doing it. But again, everybody will be affected at some point, and the percentage who are very sick is very, very less. If there are 400 cases here, the percentage who are getting admitted people are about 5 to 10, and in that 10 people there are only 2 people who are on the ventilator now. So there's a lot of techniques we are doing, treatments. It's easy to manage, provided you don't overburden the health system. Okay. So help your neighbors, families suffering from disease. Please don't shun them. I heard that people are vacating homes. No, this is not something that the end of the world. Okay. This is something of a glorified cold which we are getting hold of now, and we are treating. Okay. Again, it's like the cricket, respect the enemy. Okay. The enemy is at a stronger position. Play some defense. Play peacefully, and then we can hit them very bad. And we have a lot of treatments now, and I've got people out of the hospital. Very few deaths now, very, very few deaths. Probably one in about 200 to 300 people on ventilators for now. So we're making progress. Okay. And the vaccine's always on the way. So again, vaccines coming, it may come even before that. I projected a 12-month for the whole world, so people can get it maybe in the next 6 months. But we're very positive that we're handling this. It's not I'm not charting in an unknown territory anymore. Okay. So I've been seeing coronavirus patients in and out. So this is not something which I am too worried at this point. And I'm hopeful that just being careful, being resilient, being mindful, and being helpful will definitely help us to get through this for sure. And we are known in India for being human, to help others, and I want all of us to go back to our roots. India is such a good country that we are known to help family, friends. That's what we need to do, instead of running away from people and stigmatizing them. So please stop stigma, and it's we're making good progress here.
Super.
Right, and I close out. Sorry, I took a little bit more time than the 10 minutes because we covered a lot of topics. We'll keep going, with your questions here. So yeah, the last slide is the one which I like the quote a lot. So the things you do for yourself when you're gone, it doesn't matter. So but keep doing, helping others, and we're good. Right, let's
Super.
take some questions and we'll go from there.
Uh, yeah, I'm just going. Yeah. So this is one question. In India, it is increasing at an alarming rate, coronavirus. So what protections can we take? So
So
if you
here,
can just.
yeah, again, the protection, see that it's gonna increase. So that again, the thing is, we're going out now. Okay, it's gonna increase. So whatever we had when we quarantined, it's gonna double up, and we are testing more. Okay, so there are people who are not being tested. So the thing is, same precautions and protections. Wearing a mask, keeping a distance, isolating yourself. I mean, keeping a distance and don't going to too many functions, gatherings. People who get this a lot are people who are into this, okay, into going out, saying that this is not going to do anything. Again, respect your enemy when it is strong, and then we'll get back to it.
Okay.
So all the protections, the mask we're going to wear, whenever you're going to go. Uh, so
And this is
then,
one. Yeah.
yeah, everything, the protections, and then avoid groups. Okay,
Okay. So
what's the
this is
question?
one more question. Does virus survive on non-living things?
No, it doesn't survive on non-living things. So here's the thing. So it will survive for a few hours in the air. It's supposed to be 4 hours, but it's going to be on the surfaces. Okay, make sure you clean your surfaces, but it's going to be only short-lived. Okay, so but the answer to your question is no. It doesn't survive on non-living things.
Okay. Okay. So is it mandatory to wear a mask during morning walk?
You can wear it, and again, if you're walking, if you're doing a speed walk and then you're wearing a mask covering yourself, you may accumulate too much of carbon dioxide, and then you may pass out. So again, you have to be, if you're walking by yourself, and then you're walking with a distance from others, definitely, you can take it off. I would want everybody to wear masks, because if you have a gentle breeze blowing, even the person is more than 6 feet or 10 feet, there's a slight chance that you can get it. So yes, wear the mask, don't tie it too tight, and if you want to give yourself a break from the mask when you're walking, yeah, definitely do it. You want some fresh air too. So.
So recently in India, Hyderabad, we had a person who was denied admission into a hospital. So survival tips in case such thing happens to us.
Again, the thing is, there's a lot of stigma. People are still thinking that they're running into unknown territory. The stigma in the hospital is we don't want. A lot of the hospitals are private hospitals, and they don't want to take people coronavirus. It's I'll leave it up to them. I'm not gonna, tell things that are not right, or tell things which are against them. But it's up to their individual decision. But as a humanity, everybody should be given a chance to go into the hospital and get treated. But again, if they're denied a hospital stay, if their symptoms are not bad, again, the same home quarantine measures works better. I'll bet if there is a study conducted between people who are quarantined at an outside facility and people who are quarantined at their own home, people who stay at home recover fast, have less emotional stress, die with less heart attacks. Yeah, all this stigma and fear around it will be better, people who are at home. So I would go home and do all the things, take some paracetamol, and see if your provider can call you some steroids, and we should be good.
Okay. Uh, so what about travel, domestic or international?
Again, depending on what type of travel, okay, I would avoid crowded travel, like train travels, bus travels, and if I were to drive, I would drive with my family in my car. Okay, but air travel, again, if it's an emergency air travel, it's better actually, because airlines have strict guidelines to disinfect the spray, um, but it's not 100% foolproof. But if it's emergency, yeah, go ahead and travel. They're mandating wearing masks in the airplane, so it should be pretty safe, domestic or international. But non-emergency, I would avoid for now.
Okay. Um, So there's a person who's recently traveled from Tamil Nadu and Maharashtra. His parents traveled from Maharashtra, so he's come to Hyderabad. Since Tamil Nadu and Maharashtra are both high red zones, so at this point in time, he doesn't have any symptoms, but little nose blockage. So apart from that, he doesn't see anything. So what do you suggest to such people? I mean, such persons. How do you tell them? I mean, what kind of precautions should they be taking?
I don't believe in red zones, blue zones, green zones. It's just it's dividing us a lot, and blocking streets. This is something which could have been done earlier, but at this present scenario where we have a lot of positive news, I don't believe in this. But yeah, if you're worried, come back home, quarantine yourself at home for about 10 days, okay? And the nose block is probably nothing. You probably have some sinus infection, or just a regular nose block. Just go, drink some hot tea, whatever your mom makes, or the homemade grandma recipes again. And if you have the alarming symptoms, again, I see, is if you're short of breath, any chest pain, chest pressure, okay, those are the things which I'm worried about. But other than that, I think you should be okay, and you don't have typical features of a coronavirus, based on what I'm reading here. So
Okay. So there's a question: what extra precautions should senior citizens in diabetes people having diabetes should be taking?
see, diabetes is the one, which I've seen a lot of people getting infected with, severe cases too. Okay, these are people, you know, who are getting admitted into the ICU, a chunk of them. So if I get, 10 diabetic patients, the likelihood of, them getting into the hospital is about 1 to 2, which is still low. But the 10 people without diabetes coming in, the percentage of admission is negligible. So definitely, the people with diabetes should be more careful. Again, the same precautions apply. Okay, you go out, wear a mask. You avoid social situations, social gatherings, and non-essential things. A lot of things can be, online platforms have opened up back in India, so get them, online, and make sure you decontaminate them pretty good,
Okay.
and go from there. But again, yes, I would be worried if somebody is diabetic more than somebody who's not diabetic. And if they have, God forbid, if they have gotten this case, I would watch them more carefully.
Okay. Okay. So I heard many people are asymptotic.
Mhm.
So so asymptotic people, do they have any long term impact because of coronavirus?
No, the thing is, asymptomatic, meaning that they don't have symptoms, right? Asymptomatic, so they don't have any symptoms. So again, depending on what it is, if you don't have symptoms, you go get tested. Why are you getting tested? Even if some people have symptoms, they come, they have body aches, cold, they come to the hospital, we test them, they're positive, we send them back home. I say, you're positive, go stay at home and we'll talk, okay?
Right.
But there's no long-term effects of it, okay?
So till what stage we can take chance at home when we start having any of these symptoms?
The same thing as I told you, if you have symptoms, realistically, you don't need to go get tested. If you're having some cold, cough symptoms, and, just like a flu symptoms, body aches, take paracetamol, stay, drink some hot tea, whatever anecdotal things work at home, do it. And 3, 4 warning symptoms. I said, if you're very short of breath, you may be mild short of breath, you're very short of breath, that's the one thing I would take a chance. I would go to the hospital. If my lips are becoming blue, or your family member is confused, they're having chest pressure, they can't handle it, that's when I would go to the hospital. Till that time, I can safely avoid it. If I have some body aches, I don't need to go to the hospital, get tested for coronavirus, and then that will create a panic, and then I'm like depressed, and then family members isolating me, neighbors isolating me. But I would stay at home and just not go out, quarantine myself for the good of yourself and others. Will quarantine at home. So.
Okay. So there's another question. The numbers we are seeing daily looks alarming. So how much time do you think will India take to make a halt in spread of cases?
Again, the thing is, the social isolation, distancing we are doing is to prevent people from overburdening their, spreading it to people who are sick, who are prone, like the diabetic guys, and not to overburden the medical system. That's the whole goal, is not to overburden the medical system, meaning that if the really sick people needs to treatment, they should have that ventilator for him, they should have that hospital for him, not to be kicked out of the hospital. So what is numbers? Okay, numbers doesn't mean anything to me. Even the positives doesn't mean anything to me. So if a person is coronavirus tested positive, I'm like, okay, it's not a big deal. So if he is short of breath, he's not doing really well, then that's when I'm worried about the coronavirus. So being positive cases is a number, okay, but how much is it affecting the person is what you want to really know. So I mean, you're not going to escape this, my friend. It's going to get to everybody, okay? But how much symptoms you're going to have is what it is. You cannot escape a virus and cold. And the plan is to give time to sick people who are infected, unfortunately, in the hospital, provide them the hospital bed, not utilizing them. If somebody has no symptoms, they tested positive, they're playing cricket in some place in the quarantine center. No, no. So quarantine yourself at home, and don't go get yourself in the hospital too early. I'll give you a quick trick. So if somebody has a positive coronavirus, right? So they have mild symptoms, they're okay. The magic number is 7 days. Seventh day is when they have this what we call as an interleukin storm, 7 to 10 days. That's when people can really get sick. So that's why we said don't go out for 10 days, because the seventh day people can, 7 to 10 days, people can have this interleukin storm where they get really sick. Okay. I had one case where the person was doing good for 2 weeks and had an interleukin storm. So he came
Okay.
in, and even when he came in very sick, he was on the ventilator. We got him out. We got the treatment. We got him out. So, how much time? There's not going to be. We're not going to be able to halt this disease. Okay, so we're gonna respect the enemy again. We're gonna survive till we get vaccine, and we're not gonna overburden the hospital system. We're going to help friends, family, neighbors, okay, and then we'll make a community hospital in our own community, where the rooms, the hospital beds are their patients' own home rooms, and the neighbors helping each other, and we'll come out of this, and we'll survive till we get a vaccine, and that's how we should do as a human beings at this point.
So, can you comment on the India's? I mean, can you comment on India's situation at this point in time?
So
Alarming.
yeah, it's gonna spread. I think the positive numbers gonna go up, symptoms gonna go up. But I've talked to a lot of my colleagues.
Recovery rate has actually gone above 50%.
Yeah,
So the number of
so that
people in
yeah,
India.
yeah. So the thing is, they're testing it aggressively now. Okay, before, when we asked, somebody asked me the same question when I was doing it for the city talk, actually, that you know hey, why are India numbers so good? Why is this numbers, US numbers increasing? I said, you're not comparing apples to apples. So now the testing is more rampant. People are like, there's a fear in India that we need to get this tested, and they're positive. So positive doesn't mean anything. So you're going to be positive also, but again, the situation is alarming in terms of numbers. The numbers say that, put a news channel on, today we have 2,000 positive cases or 3,000, and they sensitize, they sensationalize this, and it's a fear mongering. Everybody is like fear, fear, fear. But how many of those 2,000 patients really require oxygen?
Right.
Maybe 20, maybe 40, maybe 50. How many do need to go to the hospital? Maybe 20. We are not exactly, I'm trying to look at a lot of data. So if they can provide us, don't go by the news channels numbers of that. If your health department can give us an exact number of coronavirus related deaths, then that's how you should take it. So it's, if they have 3,000 cases, and God forbid it's a bad strain or something, and then 1,500 died, then that's relevant. That is alarming for me. Not like 5,000 positives, 10,000 positives. No. So we need data. We need data from a reliable source, not news channels. They can project it. I mean, of course, if they get on somebody from the government.
Right. Right. Okay. So there's another question. Are diabetic patients high risk for COVID, even for young adults? Because there are some young people who also have diabetes,
Yeah,
type
see,
2. Type
anything. So, yeah, it doesn't differentiate. Age is not a factor. I have had a guy who is 21 years who died. Okay, so age is not a factor. Again, the comorbidities. Is comorbidities. Whether you are young or old, you have diabetic. You have diabetic, and coronavirus doesn't look at the age. It just looks at if you're prone or not prone. And again, young people who are obese. Okay, so that's the only thing is, I've seen people who smoke, who are obese, they are getting it, and they're akin to people who are more diabetic or severe forms. That's what I told you. I lost a patient, uh, we did heroic measures, but including trying to get them for lung transplants, but it didn't work. So, but that's a different story. But yeah, the answer to your question is yes. Any person with diabetes are high risk, irrespective of their age.
Okay. So another question on the same lines. Age range, is the age range the same? 60 plus years are more prone, and the young people will, might
So,
not get it. So
yeah, so again, the same thing is anybody who is 60 plus, okay, and having diabetes, hypertension, heart problems are more prone, okay, more prone to develop severe symptoms, okay. So the risk of exposure remains the same for all age groups. So a 20-year-old may get it and he may have some sniffles and he'll be okay. As you go on to a 30-year-old, they may have some headache, some cough, and some shortness of breath. They're okay. But as we go, more than 60 years, the risk of them getting hospitalized and the infection becoming severe is higher. Okay, and then the rate of them getting admitted to the hospital if they are 60 plus and having a diabetes or any other comorbidities is still higher. So again, we're getting treatments, we're trying steroids orally. We may not, we may halt the process of, getting people more sick, with the steroids, which is again, game changer at this point. We've been using it, and we're getting good symptoms. I mean, good reports and success actually.
okay. So in the same vein, we've seen some cases for young kids, I mean babies or kids below 5 years, who are getting rashes on their bodies and who are getting admitted. They're saying it might be because of coronavirus. So is this something new that kids are getting and not the adults?
No, the thing is, this virus manifests differently in young children. So, there's something called as a COVID toes. Okay, so you look at the kids' toes, they're bluish, purpley, discolored. Okay, that's the first
Okay.
symptom. Okay, so again, adults, the three prominent symptoms is, first, the most thing we have noticed recently is they have loss of smell, loss of taste. Okay, those
Okay.
are yeah, early signs of that you may be infected with this is loss of taste, loss of
But
smell.
how can we say that with kids of, less than
But
5 years old?
they get some sniffles, and then they're not getting the loss of taste. Also, they don't know what it is. They keep on
Right.
eating, jumping, and you see them, oh man, you see a small purplish toes, and that's all they may exhibit. Okay,
Okay.
some people have become more sick. Again, they say that a lot of little children got sick, got into the hospital, died. That's all in the news. But again, they have something going on. if you look at their medical history, they have something, a congenital disease or something they're being affected with. So,
Okay.
healthy adults, they have what we call as a Kawasaki syndrome types picture, meaning that the kids, the lips can get swollen up, they have generalized body rashes, their eyes can become red, conjunctivitis, and skin can peel off. Those are the symptoms which I have seen in some of a very few subsect of kids.
Okay. But even the kids must have some comorbid conditions to get coronavirus. Is that it? What you're trying to tell me?
If they are affected and they are admitted to the hospital again,
Okay.
so people, the more sicker people on the ventilators or people whom we are losing, dying, these are the people who have something underlying.
Okay. All right. So there's one more question. So despite knowledge, how doctors themselves get coronavirus? Is it due to lethargy?
No,
So
so I would say lethargy in a different term, overtired. See, doctors, I've had a lot of my colleagues in India. You have to have a very soft heart for them. If I treat 10 coronavirus patients here, I have a staff of 25, okay, nurses, techs, vitals, lab technicians. Back home, I spoke with a couple of people. They are seeing 35 people. There are only two doctors. All the nurses don't come. They only draw the blood. They only give medications. Some of them are real heroes in life. They just do everything, and then they don't sleep. They don't eat well. They're always on stress. Okay, and it's a good recipe to make some mistake, right? Maybe while taking out the PPE, or while not decontaminating, or they may be exposed somewhere accidentally. So I would not say lethargy in medical term is overtired, and somebody who's almost unresponsive in a medical term, which may be true for a lot of doctors who are very overworked. My colleagues, we should always support them. I wish they could have more rest, more staff to take care of patients. But no, as a doctor, I would never say that any doctor is lethargic or lazy. Absolutely not. And I can vouch for all the physicians on the planet that we take a Hippocrates oath and we are not lazy.
okay. So so going outside for a jog versus going to a group workout class, which is more risky for young adults?
Don't go for group workout classes. They say that they're gonna, if you see all the new group workout classes, they're small businesses. They put 6 feet distance, okay, and then they say that, okay, we are 6 feet, maintaining 6 feet distance, we are decontaminating all these things, but there is a definitive risk. So at this point I would avoid to go for a workout class. They can zoom in, they can zoom, or do something online platform, and you can work at your home. You can borrow the equipment from them. That's an idea, but I would go for a jog.
Basically, you're saying gyms are out at this point in time.
I
It's
would
not
not
safe.
say, yeah, I would not say out, but again, if it's a group workout, so if you go to the gym at an odd hour, you have a 24-hour access gym, you go at 3 o'clock in the morning when nobody's there, and make sure you decontaminate all the equipment. Hey, go ahead, but I would avoid group classes at this point.
Okay. I think you've already covered this, but if for people who have joined late, if you can just
Mhm.
throw some light, Glenmark.
Yeah, the favipiravir is working, so it reduces the viral load. So it's basically you have a flu and you take a medication called Tamiflu. It
Hmm.
it doesn't necessarily remove your symptoms completely. So if somebody were to suffer for 7 days with an infection, the viral load is reduced by this medication, the favipiravir, and you're going to end up having symptoms for 3 days. Okay, so it reduces the viral load, thereby preventing catastrophic effects later on. But again, people taking on this, the magic number I told you is between 7 to 10 days is when you can have that interleukin storm. People who are like doing good, and then all of a sudden they can have this interleukin storm, only a few percentage of that. But again, if people are being treated with steroids when they go home, it prevents it.
Okay. So, have there been findings on any possible long-term complications that a recovered COVID patient may face over time?
Again, that's a very, very good question. So, thank you. Whoever this is, Shravani. Okay, good. So, here's the thing. Okay, so if somebody, I had a guy who came in who was on a ventilator. So we are talking about very, very sick people. Okay, so the sick people who are on ventilator, their lungs are all, with a lot of infiltrates, abnormal findings. They get better, right? They get better, and then they get out of the ventilator. And I have had one people die. So basically, it affects your heart also. If you're that sick, what we call as myocarditis. Okay, post-viral myocarditis is killing a subsect of people with coronavirus. But these are people who are very, very sick. I mean, you don't give them a chance, and then they recover out of this and suddenly have a cardiac arrest and die. So it's a very subsect of people. But again, long-term complications of virus. We don't know. We have chikungunya in India. That's a viral disease, and people have had some long-term arthritis effects. But at this point, we don't know the answer to it, but very less likely.
Okay. There's one more question. Precautions to be taken by marketing people when they meet doctors after coming home.
So it's like marketing people. You're like me, going to the hospital, seeing patients. If you're going to a doctor, so again, I would maintain distance. I would wear a mask. Even though I like the doctor, we want to shake his hands, avoid it. The namaste is good. Everybody universal now, so I would do that. And you do your presentations. Come out. The one thing I wanted to tell you is don't take the mask like that. If you have a cloth mask, you just take it from the sides and open it up. Don't touch the front of it. Okay, that's where you'll have a lot of these things. Okay, and then sanitize, take a shower, take your clothes off outside, or garage if you have, or any room, a washroom, and then take a shower, then come out to meet with your family. Okay.
Okay.
I was quarantining myself initially, but then as we progressed and we got confident about this disease, I'm like, okay, I'll take a shower, be with my family.
So why is there a second wave of this infection?
So again, the second wave of infection, there are two things. Okay, one thing is we're opening up the economy, right? So a lot of people are coming in out, and they're doing their own things, and so you're likely to get more exposed now than before. So that's why you're getting a second wave of infection.
Okay.
So
So yeah.
go ahead.
So there's one more question. How useful is it for non-affected people to wear masks in order to reduce the risk of getting infected?
Again, if you have listened to my presentation, the thing is, the study, I'm going to emphasize the study again. So the people, there are two people, right? The person A has COVID, the person B does not have the infection. So both people wearing the masks reduces the infection by less, the chance of infection is less than 1%. Okay, percent. If the person with coronavirus does not wear masks, and the person who is not having non-infected person is wearing a mask, right? So then also this person wearing the mask is at high risk of infection, like a 50% chance. So the third case scenario is a coronavirus patient wearing a mask will reduce a lot of infection to the other person. So the simple answer to your question is both of you have to wear masks. So mask is universal at this point. So to prevent infection, yeah.
Okay. So, what are some extra precautions that we have to take apart from social distancing, covering our faces, washing our hands? Because somebody has just asked that the governments have opened up, the economies have opened up. There's not going to be any further lockdowns, right? So, how do you protect yourself apart from this social distancing? Is there any other thing that you would like to highlight?
Again, the thing is, basic, somebody asked me, can I get vegetables? Okay.
Right.
So, yeah, can I freeze them? Again, the thing is, when you get vegetables, you want to make sure you peel them off and put it under running water. Okay. and then you wash them, then wash your hands with soap and water later on. Okay, those are the basic things. Clean the surfaces. They can linger on the surfaces for some times. Okay, and freezing, it can stay in the freezer for some time. Somebody asked me this question, which was very interesting, that if I get somebody coughed up with the coronavirus on a food product, I got it and frozen it, will it survive? Yes, they will survive. So you want to be getting frozen food, you want to make sure that you take them off their covers and put it in a transfer it to different containers and store it.
Okay. So, what are post recovery effects and how good is patient's immunity after recovery? So,
So
say
again,
a person survives COVID and he goes home, and then, so how is it? How is the immunity of that particular person?
so the thing is, again, the question is, so the antibody testing, that's a game changer again. So if you really want to know whether you have been infected and the test is not just showed that you had a positive without you having the symptoms, and it's a false positive test, yeah, antibodies is what you want to get tested for. So two things the antibodies helping you is, one, it will tell you that yeah, hey, you had the infection, right? So let me rephrase a little bit. What is an antigen antibody? I want to educate a couple of minutes. Antigen is something which is on the virus, which irritates your body. So the body says that, hey, I don't like you, virus. I'm gonna start forming an army of policemen to fight against you. That's called the antibody. There are two levels of antibodies. The first antibody is called the IgM, which is produced in active infection. And while this IgM is fighting the virus, the body says, okay, I need a backup force, the IgG. So the backup antibodies are the ones you're going to get tested for, the IgG. If you're positive for that, you have a fairly good immunity to it. So, but again, doesn't mean that you can go around, do whatever you want, just practice it. And the second advantage of this IgG is at about 28 days after they have the infection, these are the people who are eligible to give blood transfusion for blood for plasma. So this plasma will help a lot of people, believe it or not. It saves lives. So again, they're testing it now. I think India is going to do it for sure.
Okay. So, there's one more question. Can we do regular dental procedures like teeth cleaning, annual health checkups? When can we start? Because that includes a complete blood work. So, how do you answer
Oh,
this?
yeah, that's a very, very good question. So again, I would avoid, regular dental procedures. These are all not essential services. Okay. So I know that you need to go to your annual checkup, you need to do your regular teeth cleaning, but I would hold off for the next 6 months. I would
Even the
just
annual checkups?
yeah, if it's not mandatory. If it's you have some medical problems. See, you have somebody is a diabetic, somebody needs to go for the 3 month follow up. They need to go. So this is a annual regular health checkup. I'm assuming that this is something you get every year on a healthy person, and healthy people like dental procedures. I would wait. I would
Okay.
wait because the cases are rising alarmingly, and you don't want to be somebody who gets the infection. You may be okay with the infection. I'm not worried about it, but it puts a lot of mental trauma, stigmatizes you and your family. So I would avoid those things.
So, can you talk about the mental makeup of a person who survived COVID? So, after recovery, mental, effects, physical effects on a person after surviving COVID.
So again, I'll tell you two case scenarios which you shared. One case where a person heard that he was COVID positive and died of a heart attack. That's not how you should perceive coronavirus as. Okay, so you have to be resilient, right? So the thing is, if a person, I have had people survive. I've had a guy whom we thought we would lose him, but that guy was resilient. He went to a gathering, a religious gathering, and without a mask, knowing that the religious had this infection. He wanted to be resilient, and he got it. He not only got it, he got it, he gave it to his family, grandson, grandkids, everybody got it. But this guy had a lot of problems, including diabetes, hypertension, name a thing, he had it. He was like a bundle of waiting to explode like a time bomb. So he came in, he was pretty sick. And we had to move him to the ICU. I was like contemplating whether to put him on ventilator or not. And so this guy was resilient, meaning that he was like, nothing's going to happen, I have faith in my religion. Okay. And
Oh,
he survived and he didn't have any effect. So this makes me believe that if you are mentally strong, spiritually strong, okay, and even though he had, name a problem on the planet, he had it, but he walked out of the hospital. Compare
that's
that with somebody hearing a news, whether he was not even having symptoms and dying. So I think a lot of fear is attached to it. Don't fear. There's nothing to fear. Okay. So if you have a coronavirus, it doesn't mean the end of the world. So I would not worry, in this time and tested age. And at least in the last 2-3 months, we have so much data. And also the steroids are working now, and that's a game changer. Again, the vaccines on the way. I would not worry about this.
super. But there's one more question here. This is a great question. So we see pregnant women worried about their unborn child's health. So are they at high risk? What should be the precautions during pregnancy and labor? So
Yeah,
yeah.
so yeah, this is one of my consult was that lady was pregnant, got it, and we did a lot of literature search. Yeah, it shouldn't affect the unborn baby, okay, and
Okay.
the risk of coronavirus, even the baby is born, will go a step ahead and say that the breastfeeding, the coronavirus is very less in the negligible in the breast milk. So you can feed the baby, but the kids who got it from the mothers are from kissing the baby, from the droplets, not from the breast
Okay.
milk. So it's
Yes.
a breast milk is natural protection. So, but uh, pregnancy, you have to be careful. Again, you don't want to get it. It's not gonna kill or anything, but already pregnancy is such a big ordeal. It's a very tough time, and towards the end of the pregnancy is even more tough. You need a lot of emotional support, family support, and you don't want to get it again. Wear mask. If you want to avoid something, avoid it. I would doubly avoid if I need to go somewhere, except for my checkups. And other than that, I would not venture into doing anything out of the way.
Okay. So regarding the testing, so does the test report show the extent and severity of infection, or it just shows corona negative or positive
It just
generally?
tells you, see, the extent, the disease will tell you positive or negative. Again, as I told you, it doesn't matter if somebody is positive or negative. The chances of people, what are they having, the symptoms is what matters. So you have to tie up, there is a number and then there is a person. So my question is, am I treating the person with the number or am I treating the number? So that's what I always look at it. So if you have somebody who is the answer to your question is, the testing will tell you only whether it's positive or negative. It will not tell you the disease severity. Disease severity is totally clinical. Somebody has to look at it.
Okay. So the symptoms are we've mentioned already, but eyes becoming red and sore throat, are these also symptoms of corona? Because some news report somewhere said that this is case. So do you think that is the reality?
See, it's a viral disease. So I would say, it starts with a headache, okay, and a non-productive cough, meaning that you're not spitting anything, you're hacking up. You get a sore throat. People are manifesting with diarrhea. People have skin rash. People have conjunctivitis. So again, non-specific symptoms. So the three most reliable symptoms, or four more reliable symptoms, are, somebody with fever, right? Most reliable symptoms: headache, okay, somebody with shortness of breath, and then of course loss of taste and smell is there. But the rest of the things, anybody can manifest as anything. Somebody can sneeze the whole day and still have, and they're like, you think it's allergy, they're positive for COVID. So again, if it were to happen to somebody, I would take it, man. I would sneeze the whole day and be okay with it. So
Okay. So numbers portrayed on public domain about the coronavirus, is it true or are they being politically tweaked? So do
I
you
don't
have
know. So
any
I'm
view
not
on?
gonna See, this is not a political talk, and I'm not here to judge any news channels. But I would tell you that my only goal of doing this, because you requested it, is to, remove fears from people that this is not like the one which you put the chair, TV channel on the first thing in the morning, red zone, white zone, all the things flashing. That's not what it is. I want to take fears out. You should be good. So I would not comment on that.
Okay, so we'll take a couple of more questions, and somebody mentioned that you're less audible, so if you can speak up a little more.
Let me turn
Yeah.
up the volume. Yeah.
So we'll just take a couple of more questions, and then we'll end this talk. So there's one question here. So is there any possibility that a person who has been cured from COVID could infect somebody later on?
Less likely, less likely. So here's the thing, okay? If somebody has a COVID, right, they got cured, they develop antibodies. So the thing is, as long as they don't venture out within the stipulated time of 10 to 14 days, okay, give yourself, if somebody unfortunately got a coronavirus, so they're struggling through this, they got over this, they're not hospitalized, thank God, and then they got out 2 weeks later, they're doing good, everything's good, the chances of them giving it is very less or negligible. I would say no. It's not something like a bacteria which colonizes in your body, but no, I would say no.
Okay, great. So, so sanitizers are not available. What should be done?
So again, sanitizer is not recommended to begin with any viral infection. I would not, be a fan of sanitizer. It's comfort. You're going out, you're traveling, you don't want, you're not having access to water or soap. Then that's a useful area. But again, given a difference between a sanitizer and a soap and water, I would always prefer soap and water. That's what we do. We use sanitizer seeing between the patients, but we wash hands with soap and water after every other patient. And then at the end of the day, we wash with soap and water, take a shower. So.
Okay. So, is it a bacterial infection? Some people are claiming that it's bacterial and it's not viral. Is it true?
No, it's not a bacterial infection. It's a virus. Okay, so I think again, there's a lot of WhatsApp, YouTube. Somebody made it that this is a bacteria. No, we are in the 20th century. We know what a virus is, what a bacteria is. We have electron microscopes which will test it to the extent of it. So this is not a bacteria. This is definitely 100% virus.
Okay. So, some people are dying because of blood clots also. I mean, why is that? I mean, is it happening? Is it true?
So yes, as I mentioned, we're using blood thinners. So a subset of people getting infected with coronavirus, it's triggering their clotting mechanism, and then they're clotting off, what we call as a disseminated intravascular coagulation, a DIC condition. So we are taking extra precautions, and we're putting them on a prophylactic, meaning that a preventive blood thinners, okay, and that is helping them a lot, and we're preventing that. Again, that's what I told you in my blood thinner section. We're proposing that a possibly full dose aspirin for people who have mild infections, along with the prednisolone or the decadron tablets, would be the near future treatment, which will be, I think, a game changer.
Okay. So, this is the last question we'll take, and we'll finish it off. So, is the virus weakened? Do you think there is a
So
chance?
they said that it's hot in India, and the virus gets weakened in hot environments. Is there a different strain? I'm going to add one more question, which people are asking: is there a different strain of this virus? So definitely, we can now tell that the virus is not weakened with heat, cold, or anything like that. They survive. They're very extremely resilient bugs. So I would not say that this is the virus is weakened at this point. I would say that uh, there may be a different strain. So the CCMB, the Center for Cellular and Molecular Biology, they say that they have isolated a different strain. Okay, so I don't know the validity of the studies. But again, when we had in the early part of this disease, we still have a strong belief that there are two, there may be a couple of strains of this infection, which has not been proved, by the way, because in the one which is affecting people, the bad strain, people are into the hospital right away. The other ones, they're like happily roaming around without any symptoms. So again, it's all speculative, but nothing has been said and time and tested that there's different strains. So we'll keep it that way. But answer to your question, no.
Okay. Uh, okay. So if you want to take this question.
Sure. We'll go till 10:30. I'll have till time 10:30. Okay.
Okay.
So far, what was the mysterious COVID case that you treated in terms of recovery? Okay. So I got a guy, again, he was doing okay. And he came to the emergency room, tested positive, then went home, came back, and he was requiring a little oxygen. He got better. We sent him home 2 weeks later. Okay, so this is out of the window period for it to be bad. That's what I told you. 2 weeks later, this is the only case I've seen so far that guy came back and his lung infiltrates were worse, and which is out of the window period. This is when we say that, okay, your infection is done. But this guy came in 2 weeks later, and he had severe symptoms, and I had to put him in the ICU. He went from 2 liters of oxygen support to 4, 6, and 12 liters. I was about to put him on a ventilator. Then we used this tocilizumab, the ones which I mentioned is the IL-6 drug. It's also called Actemra for people who are in medical field. This changed it. The moment we gave it, 2 days later, it suppressed the immunity so much, the inflammation so much, that he came back from 12 liters struggling to breathe to 6 liters, 4 liters, and 1 liter of oxygen. He still required 1 liter of oxygen. We arranged oxygen and sent him out with 1 liter of oxygen. So this surprised me that people can. There's only, I think, only one case. I'm going to write it up. That after 3 weeks of the 2 to 3 weeks of the infection, it came back really. He didn't even have a meaningful recovery. But this guy had everything on the planet. So he was immunosuppressed, diabetic, name a problem, he had it. But he walked out of the hospital. If that can give confidence to, if anything can give confidence to me, with respect to treating this coronavirus, that's the case. I'm like, okay, I got it. I can take care of this any day. So
Okay. So a person asks, when can we expect this to finish? If he's talking about the talk, then within the next 10 minutes, we are finishing it off.
we're done, my friend. Yeah, whenever you want.
Virus, when
Oh,
it and
the talk or the virus? What is it?
next episode. So if
The talk is going to end in the next 8 minutes. But when to expect this to finish? There's no finishing point. It's a new normal, right? So this is going to stay with us. It's a good friend of us. So we're gonna from enemy, we're gonna make it to a lesser virulent, meaning that lesser dangerous friend, and we'll treat this as a common cold. Couple of years down the lane, you'll say that, oh, you have got corona, and it's just gonna be like a common cold. So
okay, the person just confirmed that it's about the virus. So okay. So
that's something good about the pure virus.
so so there's one more question.
Once say something good about this poor virus. Okay.
So Italy claims that it has developed a vaccine. So do you think that's true or no? That's again a new sensationalization by news channels.
So the thing is, the vaccine developing is one, it's a big phase. Okay, so I'll tell you one thing. So the vaccine is a big money market. Okay, I'm not going to be negative, I'm going to be positive, so don't get me wrong. But so every company wants to make their own vaccine, right? So but the thing here is, this is the first time that 3 continents, everybody is collaborating to develop it for the good of humanity. There's a different stages of vaccine. So you do a lab trials, then you do an animal trials, then a human cell trial, then a human trial. then the human trials, they'll see the side effects of the vaccine. Nothing comes without a side effect. Okay, so what side effects are there, so they refine it, and they make sure that if there is a strain of virus, they put it in. And so there's a lot of thing that goes in developing a vaccine. Okay, so the vaccine is developed. Okay, it's not that it's not developed, it's already done deal. But to get it out to the market safely, it takes time. That's what takes the time. So we have the vaccine. I'm pretty sure we have it, but it's just when will it reach us is a matter of the question is, you have to think about that.
So if tested positive and quarantining at home, can the symptoms rapidly increase in a few hours, or it takes a more gradual turn?
It
And
takes gradual again, so it takes about
hospital faster. I mean,
so again, that magic number is 7 days. So you are surviving at home, you have some mild shortness of breath, you're doing okay. After 7 days is what you'll be okay. But seventh day, you have to be very careful around the seventh day, where people are getting more sicker and they need to be hospitalized at this point.
okay.
So seventh day, but then it's not a rapid thing. It's not like you tested positive now and you fell down and you're going to be hospitalized. No, very rare, very rare. Gradual severity will going to be going up.
So I think you've covered this, but I'm just asking again: what types of medicines are proven to help reduce the risk of death for COVID patients?
Uh,
What type of medicines are proven to help reduce the risk of death for COVID patients? Is there any treatment
So
for?
yeah, the steroids are there, the tocilizumab. So you see, the thing is, it's your own body's immunity that's acting against you. So you're trying to suppress the immunity, at the same time getting rid of the virus with the remdesivir, the favipiravir, etc. Okay, so
Okay,
those are the things.
all right. So, is there any key recommendation for homemade cloth mask? Because everybody can't have N95 or N100 masks, right? So,
Yeah,
is there? Yeah.
yeah. Let me see. Okay. Right. So anybody can make a mask, Rekha. So anybody can make a mask. So you have a cloth mask, you can just wear it. There is no recommendation. So you just take piece of blanket, old cloth. You just make some, threads, and you can make it. And there's a lot of online things where you can wear a mask. But there are filters. If you can get a filter to put it in, that's good. But it's available in hardware shop, the AC filters. So, but again, a plain cloth mask is better than anything.
So there are no recommendations as to this is the kind of mask that you have to wear when you're going. No, anything which covers your face and mouth, or nose and mouth, is what is important.
Is important, yes.
Okay. So we'll take two final questions because we'll have only that much time. So we take our dogs out to the dog park while maintaining all the social distancing procedures, but our dogs play with other dogs. Do we need to give them a wash down every time before entering home?
So the risk of transmission, yeah, that's a very good question. Give me 1 second, okay? Let me take this page. It's about somebody crashing. 1 second, okay? Hold on. I'll tell them. Sorry.
So we'll just run through the presentation. So as the economy opens up, we need to keep distance, emergency travel.
Rekha, so sorry, I'm back. Okay.
Yeah. So it's
Sorry, I had
just
to. Yeah, it was
presentation.
a hospital call. I had to take it. I'm sorry. Yeah, sorry, guys. So yeah, so this is a very good question. Right, the risk of transmission from an animal to human is very less. Okay. But yeah, I don't think you need to give a wash or anything like that. But if you feel like that, do it. But they have done a lot of studies at this point. The risk of transmission from an animal to a human being is very less.
Super. So yeah, I so survive the virus is the ultimate challenge. Is that so?
No, I think, this is initially, I would say, yes, 4 or 5 months back, I would say, oh my God, what's going on? We don't know it. So now we are being educated. There's a lot of simulation. If you see the medical world, I wrote, I'm writing some recommendations on the hospital medicine platform. But again, we know a lot about it now. So this is not like a life and death sentence. The COVID is not life and death sentence. It's just like a glorified cold. We got some treatments. We got treatments that are working. So I would not worry about it as much as I did in the past. Again, saying that, it's not like, okay, you have to go around. This is nothing. It's not a death sentence, as I told before. So we are okay. We're okay. I'm very positive that we're okay.
Okay, so let's end on this note. Say something about this virus, poor misunderstood virus. So,
It's a poor
so
thing that was in China, got to everybody, and then it's trying to extend friendship to everybody on the planet. So, yeah,
yeah,
please, we'll
we
welcome
should
this.
we, yeah. We should make sure that this doesn't become a stigma. We should help others. We shouldn't close doors on people's faces, and we should let and I mean we should respect the virus. Is what you're going to say, right?
So I would, yeah. So the respect is, again, it's like the enemy. We known about the enemy now. We know what we can do. It's not an enemy, It's something which came. Virus is Uber. It's everywhere. So I think you have to respect it and make sure you're not giving it to each other on the families. But again, we're trying to target this 6 to 8 months from now. This will be okay. You got corona, I got corona. So a couple of years from now, I think everybody will be okay with this. So oh, I got one more question there. So.
Oh, okay. Yeah. So, any proven vitamins or herbs? No.
So nothing's proven, but vitamin C will prevent inflammation. We used it in people who are septic. It helps. But whatever you feel like taking, don't overdo it. But you can take it, for anecdotal effects. But nothing scientifically proven to help it. It will only modulate your immunity, which is good. Vitamin C, vitamin D. Okay, they say they have some effects, and hot tea, drink it. But again, it's not going to do anything to the virus.
So, somebody says they've made several calls to 104. There is there any medicine that you can suggest at home because her health is not concerning though. Somebody's
Yeah, just
mother.
just give her some Tylenol. I don't think they need to be just, yeah, paracetamol. Sorry, paracetamol. She can take it. The Dolo 650. She can take it every 6 hours, and just keep on giving it round the clock for her, and make sure that this is, she has the symptoms like a body aches and all that stuff. The biggest problem is, if she is doing okay with the fever and some body aches, we're good. Again, watch out for the warning signs of bluish discoloration, confusion, shortness of breath, chest pressure. Okay, if that were the things going on with her, I would take her to a local hospital or emergency room. I don't know whether pulse oximeter is available in India that will test how much oxygen you're doing. Even some phones have the apps that you put it, and it will tell you how much you're oxygenating. So as long as somebody is oxygenating above 90%, I'm not worried about it.
Can you mention that?
It's called the pulse oximeter. Okay, it
Pulse.
will oximeter. Okay, so basically you put
Also,
it in your
apps on
hand. Yeah, there may be some apps. I don't know. You just put it. It's like it just takes the amount of oxygen you are getting from your lungs. Basically to the whole body, the blood circulation, how much oxygen is being carried. So if it's above 90%, we're good. So if somebody has the pulse ox, that's what we call at home. That's very useful.
Okay. So, Anna, thank you so much. I think we have answered most of the questions. If there are any further questions, you can always put it in the chat. I mean, and in case we have another opportunity, we'll again answer some questions. So, I think WhatsApp will not agree if you say proven vitamins or herbs, which don't build it.
So I'm not going to raise any controversy. You want to take anything, you take, but I'm sticking by evidence. So, yes.
Okay. So, yeah. So, thank you
Hey,
so much. Yeah.
Yeah, thank you, Rekha. Again, I want to tell people back home, please do not panic, and please do not stigmatize others. I heard people vacating houses. That is overkill. I mean, this is not something like a deadly virus. That's a death sentence. Again, I've been emphasizing, be positive. We're gonna get over this pretty soon. I'm pretty positive that we have good treatment options, and if you're not overburdening the hospital system and physicians and doctors, they will take care of the sick ones and get them back to you, if it were your family or friends, in a safe, in a healthy condition than they left home. So I want everybody to be positive. So there's one more question. I want to take that because it's very important. The last one, I don't know. Yeah. So, okay. So, hey, this is what I am like so upset about some of the health systems back in India, that, they're getting people in, charging so much money and doing a CT scan as a diagnosis for coronavirus. That's absolutely not valid, absolutely wrong. And I would, if you given me a chance to speak my heart out, I would say it's absolutely unethical. But the CT scan should not be used to diagnose coronavirus. Its symptoms, and in the worst case scenario, you want to do it, you do the nasal swab. Okay, so the fluid in the lungs can show that you have infiltrates. In a ton of things can show that you have infiltrates. I agree that the CT scan of coronavirus shows some definitive pattern, but that should not be taken, and should people should not be exposed to this radiation. CT scan is a radiation, and absolutely not something which I would subject any of my patients to.
Okay, super. So we've actually done another podcast with Anna. So this is the video for that. I'll post the link in the description box. You can always go ahead and see that, and you can have some more questions answered in that video as well. So this was today's video, and this was the coronavirus FAQs which we did last time. So please go ahead and see that, and I'll post the description link in the description. So I hope you have got some value out of this video. Anna, thank you so much that you have taken such a lot of time to answer so in depth so many questions from people. And so it was a wonderful interaction. I hope everybody has got some inputs from this, and they've got some value from this, and they've got all their questions answered. So if you have liked this interaction, please like, share, comment, and subscribe to my channel, and like my FB page as well. So we will sign off. Thank you so much for your patience. Anna, thank you so much again.
Yeah,
Thank you, everybody.
thank you for involving me, and hopefully we'll be positive, and hopefully, at the end of this talk, the only thing I want people back home is, be positive and be courteous and be helpful, like what we have always been. Thank you again. Thank you.
Thank you so much, everybody. Thank you.